Okay, good morning. So this talk is about the prevalence of ocular and visual abnormalities following symptomatic and asymptomatic CMV infection. And it has been a systematic review and meta-analysis. Thank you. So these are my co-authors you see at the top here. And this study was run by Lola Salibo at Great Ormond Street Hospital in London. So in context, congenital CMV is the most common congenital infection. It affects 1 to 2% of live births worldwide, and we know that there is a higher rate in lower income countries. Congenital CMV is recognized as a cause of visual disability. So in this work, we looked to divide congenital CMV into patients who have symptomatic CMV and those who are asymptomatic. So just a reminder here of the features of symptomatic CMV. And this is a European consensus guideline, which was published in 2017. And you can see here the features the neonate may have to be diagnosed with congenital symptomatic CMV. And that includes particularly hearing loss, but other systematic comorbidities, several of which you can see have potential to be visually disabling. So around 1 in... So the analysis was targeted at looking at visual impairment and structural disorder as separate, aiming to get a separate pooled prevalence for each. And those pooled prevalence measures were assessed for bias, heterogeneity, their sensitivity, and confidence levels in the pooled prevalence. The data were then sub-analysed, looking particularly pre and post that quite landmark European diagnostic criteria being introduced in 2017. And they were sub-analysed for study design, follow-up time, study population, because some of them were particularly looking at hearing populations versus the whole population. Some of them particularly were looking at premature birth, and we also looked at what level of income the country from which the paper originated. So, of the 12 studies included, this included 1,100 asymptomatic children and 780 symptomatic children. All of those papers came from high or middle income countries. There was a really variable preterm birth, normal being about 10%, so it was quite varied. And the median follow-up, again, very varied, from 35 to 156 months from diagnosis. So this is really what we were aiming to see. So these are the pooled prevalences. So we looked, again, at asymptomatic and symptomatic patients for evidence of visual impairment and ocular disorder. So if we first look at the asymptomatic column, the pooled prevalence suggests a level of less than 1% visual impairment in children who have no other symptoms of CMV systemically. And similarly, there was less than 1% rate of ocular disorders in these children. So generally, at quite low risk, if they have no other systemic findings, quite low risk that we will find an ocular or visual problem by screening. By comparison, symptomatic patients had a quite significant risk of visual impairment, 10% in the symptomatic patients, and an even greater risk of ocular disorder. So 1 in 10 patients with symptomatic CMV may have a visual impairment. And if you sort of just keep that number in mind, a little bit more detail there. Now, there was a bit of heterogeneity, so between 0 and 22% were the rates quoted, and you can see that the results are somewhat variable. But of interest, patients who had moderate or severe visual impairment, 75% of those were from a brain-based cause of visual impairment rather than the ocular cause resulting in visual disability. There was no significant difference when we adjusted for diagnostic modality, how the records were recorded, how the studies were done, the population, or the length of follow-up. The commonest structural disorders found in symptomatic patients were chorioretinitis, as you might expect, optic nerve hypoplasia, and anterior segment abnormalities, cataract, congenital corneal opacity, with these kind of levels of prevalence. But when they were adjusted for hearing impairment, children with hearing impairment related to CMV were much more likely to have a structural eye problem. If they were preterm, they were much more likely to have a structural eye problem. And in that pre-2017 consensus, the rates were much higher as well. So, I believe I've got 10 minutes. I'm carrying on. In the asymptomatic populations, you can see that the results were more heterogeneous, and these results were robust to omission of individual studies. So that's one way of testing the validity of those data. So an outcome of this paper, we said we were looking to try and understand who should be screened. And the data we have suggest that all patients obviously should be checked at birth if they have congenital CMV. But if they're found to have no ophthalmic manifestations and otherwise are asymptomatic, it's possible that they should just go down the routine, usual screening of any normal child in the population. Of course, there are times here that if there are developmental concerns that arise, or if hearing loss develops later, they could be moved over into the symptomatic group and join ophthalmic screening. Those children with neurological manifestations and, of course, with ocular manifestations should then have regular ophthalmic input. So these are, pooled prevalences are estimates of a level of disease from the literature. The results were somewhat heterogeneous, and CMV is tricky because there are different ways of defining what is symptomatic CMV, and those things do vary internationally. And of course, some of the populations are specifically looking at hearing loss populations, so there may be some biases within those papers. When people did report visual disability, they didn't always make it clear whether that was from an ocular reason or from a brain-based reason. But where it was reported, visual impairment did seem to come from cerebral issues from CMV. There has been a previous similar study published in 2012, and actually our pooled prevalences seem higher in the symptomatic group and lower in the asymptomatic group, so probably more clear-cut in terms of how one would screen. And those differences in result probably do relate to those changes in diagnostic criteria, because if we're better at picking up symptoms, doing more brain scans and looking harder against those diagnostic criteria, there are possibly more children in the symptomatic group than would have been pre-2017. It's really important to note as well that 10% of children who are initially asymptomatic may go on to develop hearing loss, so they do need to be in screening programs. So this study had its limitations, and there was a lack of detailed information in the literature, so we can't be really clear about how screening would be ideally done. Of course, we all know with pediatric ophthalmology, you can't look at a child at birth and tell anyone how their vision is. We are slightly limited by age-limited testing. Of course, there was only a small number of papers that really fit our criteria. And importantly, we know there is a burden of congenital CMV in low-income countries, which were really not represented in these data. So take-home messages. 1 in 10 children with CMV will grow up with visual impairment. And more than that, will have structural ocular abnormalities and will require ongoing eye care. Majority of visual disability that was found was from neurological causes. And with asymptomatic CMV, there is a low likelihood of visual disorders in these children. But remember that there's an increased risk if their birth was preterm or that they go on to develop sensory neural hearing loss. Thank you very much, and all the references are there in our paper, which is in submission currently. Thank you.
Thank you, Dr. Naomi.
Thank you.
For the very nice brief up on the CMV. I would like to have a few comments from Dr. Dolso.
Thank you, Dr. Naomi, for a nice presentation and enlightening the audience regarding a very important disease which may be responsible for causing disability in the children. So, what you think, how you can advise the people that they can be more, say, vigilant, or they should be more sensitized for taking care of these types of problems?
That's a good question. So, in a condition that's not universally screened for, we may be relying on parents to pick up signs, people to be aware of things. So some of the suggestions in the more detailed paper include to have greater public health awareness of visual issues, to have robust screening of all children. Of course, we know you can pick things up at neonatally. You know, in the UK, we have a 2-year check of general development, which may pick up visual issues. At you know, starting school, children's vision's assessed as well. But also parents feeling able to you know, come forward and say, I think you know something's not quite right here. It's really important, particularly in big populations where screening is not in place. That's an important measure. So it's a very good point.
Thank you very much.
Thank you. As far as India is concerned, around 80 to 90% of the female in ANC period, they are seropositive. So that is the situation in India. And around, I would say 3 lakhs babies are born every year with CMV positive in India. Thank you, Naomi.
Thank you.
Yeah.